My name is Andrew Kelly. This is evaluating the performance of large language models in addressing preoperative patient questions, a systematic review and analysis. Large language models such as ChatGPT are being increasingly explored in the perioperative setting. Their application has been shown to improve accuracies, efficiencies, and patient management. The aim of this study was to look at all papers that assess the performance of large language models at answering patients' preoperative questions across a range of different characteristics and domains. A systematic search was performed in accordance with PRISMA guidelines across PubMed, Embase and Scopus. Ultimately, 17 studies met inclusion criteria. The data collected ranged from the number of reviewers, the number of questions asked of the LLMs, and then the performance metrics that were specifically measured in each individual study. The evaluation methodologies varied greatly across all studies, but the most commonly used metric was a Likert scale, either 4, 5 or 10-point scales. So we used weighted averages and normalized values from 0 to 1 in order to group and compare the different domains. As you can see from our results, accuracy was the highest scoring domain, completeness scored lower. With regards to readability, there was 2 scales that were used with abbreviations FRE and FKGL, and the score is equated to a college graduate level of difficulty of responses generated by large language models. We were able to go on and perform a subgroup analysis showing that orthopedic studies gave LLMs the highest rating for accuracy, and gynecology rated them the lowest. This is a table showing how we generated our weighted averages and our weighting. The weighting was based off the number of reviewers times the number of questions, and then we gave the different Likert scales a normalized value from 0 to 1 in order to compare all domains. And here's a bar chart comparing the different domains with accuracies being shown as the highest. Briefly, in conclusion, our results show that large language models are showing strong results in terms of accuracy and reproducibility, but perform more poorly in terms of readability, completeness and empathy. Limitations that are commonly quoted are the lack of source referencing of LLM responses, difficulty with nuanced queries from patients, and no individualized surgeon preference tailoring. So this could be said that LLMs are likely an adjunct only to clinician-led counselling. The implications of this study is the first systematic review of its kind that we're aware of. The results for LLMs are promising, but there is, of course, more research required. Thank you.